Today we have a couple of friends, one who is a very close and old friend of mine, Brian Floyd, who is the president of Vidant Medical Center, and Dr. Joan Wynn is here. Dr. Wynn is the Chief Quality and Patient Safety Officer for Vidant. Good morning, folks. How are you?
Good morning.
Good to have you.
Thank you for having
Happy
us.
to be here.
Appreciate you. There's some good news to share, right?
That's
So
right.
we understand Vidant Health, four Vidant Health hospitals, Vidant Beaufort, Vidant Duplin, Vidant Edgecombe, and Vidant Medical Center here in Greenville have just received an A grade from the Leapfrog Hospital Safety Guide. What exactly, tell us about that. And first of all, congratulations. But it means clearly that some good things are happening for patients. Joan, you want to tell us about it first?
Sure. Leapfrog is a group that was started back in 2000, and it's a group of nonprofit purchasers and employers who got together and wanted to drive leaps forward in quality and safety in hospitals. And they focused on things like computerized physician order entry and safety culture. And every year now they produce a safety grade for hospitals across the country, looking at publicly reported data on things like infections and hand washing and those kinds of things. And as you mentioned, four of our organizations got the grade of A. So we're really excited that the work we've done to improve is now being recognized externally.
I presume that's not easy to do, Brian.
This is the first time, the medical center, this is the first time we've ever been near these scores before.
Here, you mean the Greenville
Yeah.
location, Vidant Medical Center?
Right. A medical center that's tertiary in nature in the population that we serve, we know it's extremely difficult for us. But I'll tell you, that I'm proud of the results, not just because of Leapfrog. Leapfrog is one of these grades. But really, when we looked at our composite of scores, meaning that the ongoing work we have to improve and the things that we measure that show us that quality is really improving, this was a year where across the board, whether it's Leapfrog or the ranking among the academic medical centers that's known as Vidant, all of these have shown us that the Vidant Medical Center has reached its highest level of quality outcomes in the history of our measurement of the medical center. We set a goal a few years back not to achieve Leapfrog scores or any of those things. We set a goal to yearly, every single year, to reduce events, improve quality every year, year over year. And we're pursuing excellence in that way. And the results then are that these scores now show us as a high-ranking organization. I'll tell you specifically the one that we are very proud about when we compare academic medical centers, of which Vidant Medical Center is one of those. We rank ourselves not against just every hospital in the country, but we really care about those that are like us. The Johns Hopkins of the world, Duke, Cleveland Clinic, Mayo Clinic, all those that you think of as academic medical centers that are providing premium services. That's who we compare ourselves with. And about 5 years ago, we were in the bottom quartile of comparison of those organizations. Now, keep in mind, those are the nation's best 120, organizations. We set a goal that we would eventually want to be in the top quartile among that grouping, and this year's the first year we've reached that milestone. And so across the absolute measures of quality, mortality, patient safety, patient experience, Vidant Medical Center is in the top quartile of all the hospitals that are teaching hospitals in the country.
And an A in patient safety. And Dr. Wynn, some people may not really think about Vidant Medical Center, but I mean, you think about how difficult that must be to get a grade of A, because the truth of the matter is you guys get the sickest of the sick in eastern North Carolina. When there is someone who is extremely sick and taken to just about any hospital east of Raleigh, and they're not able to be taken care of in that particular hospital, they end up in Vidant Medical Center. So you're taking care of some very sick people, and unfortunately, we live in an area where we have a lot of sick people.
That's right. We have a huge amount of chronic disease in eastern North Carolina. I'm sure your listeners have heard of we're the buckle of the stroke belt. We have a significant number of people with kidney failure. Diabetes is higher than the state and national averages. So all of those things are conditions that people come into the hospital with that make them at more risk for having harm events or things like infections to occur while they're in the hospital. And Vidant Medical Center is one of the top, always in one of the top 5 in the entire entire country in hospitals receiving transfers of patients from other hospitals.
Right. Well, every experience I've ever had with a family member has been a tremendous experience, and so to get an A rating in patient safety, I think that's a big deal. How about other designations? You've had other things happen recently that are positive as well.
Yeah, there's, again, I liken it to, we've been running a race to improve every year, which means when you get to a certain level, you start to see lots of different awards and things of that nature. And we don't chase awards, Henry. This is not an organization that we try to go after all these awards to then say we've achieved that, because it's an ongoing process. And every hospital in the country is also trying to improve at the rate that we are. What all these things tell us, though, are that Vidant Award top quartile in academic medical centers, Leapfrog A, many of our programs, whether they're cancer programs, or I'm thinking about our heart programs where they just received the highest ranking among heart surgery programs in the country. All of those things are just indicators, though, of the overall performance of the organization. And as you mentioned earlier, in a very difficult population to manage. And that's the result of people every day at Vidant Medical Center and in our regional hospitals who recognize the patient population we're serving they require a tremendous amount of coordination, a tremendous amount of work. And we don't worry about that. What we do is say every one of them are going to get the best care possible. And so in our pursuit to improve our quality year over year, you're right that these are just awards that come as a result of our ranking when compared to other organizations. And that's going to move year to year, by the way, because every hospital, the rankings change every year, the conditions change every year. But we're at a year where at least we could pause and say, our teams, the nurses, doctors, from everyone that transports patients all the way to the surgeons doing surgery, they have been focused on how to get better every single year, and these results are the manifestations of that work.
Brian Floyd, the president of Vidant Medical Center, Dr. Joan Wynn, the chief quality and patient safety officer. Dr. Wynn, where do you go from here? When you get an A, what do you do for an encore?
Well, the first thing we do is try to celebrate for a minute. So we appreciate the opportunity to come here and just recognize the improvement. And also, it really does give our staff and our teams a shot in the arm. As Brian said, this is a continual journey. And we feel like we're pushing the rock up the hill, every single day. And our true north is the zero goal, 0 events of harm and exceptional experiences for every patient we serve. So we continue on that journey across the health system. We use rigorous methods to understand our performance, to analyze the data, to identify our opportunities to improve, and then to go after those improvements day after day. So it really is the frontline staff that are getting it done.
Awesome. Anything else you want to mention about that? Because I got some other stuff I want to ask you.
Sure.
Anything else about the patient safety rating?
I'll only say this, if I can take the moment that we're here on the air to say thank you to our people and their families. Because our folks do very difficult work every day for long hours, and they come home and their lives are sometimes disrupted by the call to say we need you back at the hospital, or there's been a change of condition of a patient and a physician has to come rush back into the hospital. Many people across the region lose sight of that behind the scenes, these are dedicated families who have given a lot to make sure that Vidant Medical Center and Vidant Health can continue to provide this care for Eastern North Carolina. And I'm always amazed at the level of dedication that our people have.
Yeah.
And so I just want to say thank you to them.
I echo that. Congratulations. This is awesome news. Being right down the street from you guys here at our complex, Vidant Medical Center is such a source of pride for those of us who live in Greenville. But I was going to give you another compliment. If people haven't driven by, and of course, we think about Vidant Medical Center, it saves lives. It's the economic engine that drives, I think, Greenville these days, that and the ECU and the School of Medicine and everything. But if you haven't driven by Vidant Medical Center at night, it is such an incredible complex. I had a friend that came in from out of town recently, and of course, when you drive straight in, and now when the 10th Street Connector's done, you're going to drive straight up and keep going right down toward the university, which is going to be really cool. But it's such an attractive, aesthetically pleasing thing to see, and it looks like it's just a beautiful facility. Also, with the new Maynard Children's Hospital, the way it's lit at night and everything, it's amazing. But you've got the new cancer center, the heart center. I mean, you know, for a guy that kind of came here in 1971 to go to college, and this was. I think there were 36,000 people in Greenville, and it was a tobacco town. To see what's happened there is unbelievable, and it's just it's an unbelievable success story, is it not?
It is, and I say this all the time, but for those listeners, that it's easy to lose sight of that because we get so accustomed to having these resources here in this community. But the reality is, Vidant Medical Center is among the nation's largest 1% hospitals. So less than 1% of the hospitals, all hospitals in the United States,
Right.
come within 100 beds of the size of that organization. And that's an anomaly. That's not normal.
Right.
Now, it speaks to the region. It speaks to the need that we have for those services in eastern North Carolina. But it is a very unique
Right.
and very precious thing that eastern North Carolina has.
And we're so lucky to have it. I mean, when I go out of my office here and go to my car, the helicopters are coming and going. I mean, and it's. I have to stop every time I see one of those helicopters taking off because we can see them literally take off right behind us here, and I kind of stop and kind of mentally just stop for a second, say a little prayer for somebody because somebody's in danger.
And I thank you for saying that because Henry, the reality is people are putting their lives in jeopardy to help care for other people.
Right.
More importantly, behind every aspect of our health system, there are people hurting, there are people in crisis, and there's a story that's going on, and sometimes they're phenomenal stories.
Right.
There are stories. We have a NICU that has 50 beds in it, meaning that there are 50 neonates that
Wow.
are premature that we're taking care of, and are going to have life that otherwise they wouldn't have without those resources here in eastern North Carolina. There are behind every cancer door, there's a child or an adult ringing a bell with our staff celebrating their last chemo treatment
Right.
as they have completed that regimen. There are babies born into the world. There are just phenomenal stories of success and help that Vidant Health brings to eastern North Carolina.
Well, it's boy, Vidant Medical Center sure been a big part of my family's life. We had an incident this year where we needed you guys again. And I tell you, the care that we have gotten in our family there has been amazing. Give us a little update on the cancer center. We see it rising, and it looks like you're getting closer and closer. And we're going to have now right next to that huge heart tower, a cancer tower. Tell us what the latest is on that.
It is the largest building expansion that we've ever undertaken here, and it is a phenomenal. If you go inside that, it's daunting. I was in there just a week ago. With our construction folks, just looking around, and it reminded me just how very, very large the building is. But what's so great about that is, one, it gives us expansion space of our hospital. We have to always be, it's such a large building that we have to continuously be in a building phase so that we can keep up with the need to renovate and replace old facilities and that sort of thing. And this gives us expansion room. But it also brings together caregivers. And so what's great about facility investments like that, one, patients and families deserve to have an aesthetically appealing place, and a facility that creates confidence and hope and healing and that kind of thing is very important to us. But it also brings together caregivers. People want to join a team where there's an investment in the work that they do. And so part of this is strategically to help assemble the right team, the right process, for what is a very needed population in eastern North Carolina. But it will be incredibly large. It is more than triple the size of our current cancer offering.
Wow.
We currently use about 20 chemotherapy bays as an example, and this facility has 60.
Yeah.
So private rooms for all the patients. It really
And when
is,
will it open?
so 2018, probably March of 2018.
Yeah. Okay. It's impressive when you drive by there. All right, Brian Floyd from Vidant Medical Center and Dr. Joan Wynn from Vidant, the Chief Quality and Patient Safety Officer, and of course this new designation by the Leapfrog organization, giving Vidant Medical Center an A in patient safety. Just an incredible thing. Anything else, Joan, you want to mention?
I would just, to kind of follow what Brian said about the stories of the patients and families that we serve, that has been one of the strategies we've used in the quality and safety work, is to share those stories widely. We have patients and families come to our board meetings to share their stories of care with our board. We start every meeting with a patient story to really connect the hearts and minds of our team and make it not so much about numbers and grades, but really about the actual people that we serve in Eastern North Carolina.
Mm-hmm.
They're our friends, our neighbors, our family, and so we use that as one of the tools to help us drive the work forward.
Great.
And I'll say in closing also that these results, and I really appreciate you giving us an opportunity to share them, but they are the result of intentional work for many, many years. And we wouldn't be having this conversation more than likely today if Dr. Wynn had not been our patient safety officer for these years, because she is part of the reason we're where we are. She outlined a strategy. She helped our teams put together a strategy that would make sure we could achieve these kind of results. And so I also want to say thank you to Joan and her team, because it's a big part of our journey.
Thanks,
Congratulations. Good stuff.
Appreciate it.
We've had some great leadership at Vidant over the years. I think about my friend Dave McCrae, who really oversaw the
Absolutely.
incredible metamorphosis that's taken place here in Greenville. And my buddy Steve Lawler, who had your job before you, who's now in Charlotte with Carolinas Regional. But I tell you, I've never felt better about the leadership at Vidant, with Dr. Mike Waldron as our CEO, and Brian Floyd, who I hate to say this because I brag on Brian all the time. Brian is
Keep bragging.
He really is one of the sharpest, most intelligent people I've ever been around. And in meetings with Brian, the way he can communicate with people is extraordinary. And I really mean that.
Thank you.
I want to say it publicly because I say it to you all the time. But I feel great about the leadership we have.
We have a great team across the board.
And it's nice to have you here as well, Dr.
Happy to
Wynn.
be
Thank
here.
you. Absolutely.
Thanks.